Hello, welcome to MedZone by Dr. Farjana Afrin. Today my video lecture topic forearm, extensor compartment and anatomical snuff box. In this video lecture, I am going to describe about the different muscles of the extensor compartment of the forearm, their nerve supply, action and anatomical snuff box, its boundary, content and clinical importance related with the anatomical snuff box. So let's start. Back of the forearm, or we can say extensor compartment. Already we know the forearm is extending from elbow to wrist, and it's basically the posterior sides of the forearm. That's why we are saying back of the forearm. Now functionally the muscles here whatever located, they will do extension of wrist or maybe extension of some other joints beyond the wrist also. So like the fingers also can do extension. That's why according to the function we say that it is the extensor compartment of forearm. In extensor compartment we are going to get muscles, artery and nerves. So let's summarize first. If we see muscles will be also in two. First the superficial and next will be the deep. Total number of muscles here will be the 12. And here the superficial muscles are 7 in number and deep muscles are 5 in number. Now if we see superficial muscles, according to their arrangement also again divided them into two. Some are laterally placed and some are purely posteriorly placed. Who are laterally placed? Number 1, brachioradialis. Then I am writing in shortcut extensor carpi radialis longus. Then extensor carpi radialis brevis. These three muscles are laterally placed, and posteriorly placed muscles are extensor digitorum, then extensor digiti minimi, then extensor carpi ulnaris, then then anconius. These are the superficial muscles. As I said, total number are 7. Laterally placed 3 and posteriorly placed 4. Now, what are the deep muscles? When we see the deep muscles are total 5 in number. Number 1, supinator. Number 2, abductor pollicis longus. Number 3, extensor pollicis brevis. Number 4, extensor pollicis longus. And number 5, we are saying it is called extensor indicis. These are the muscles. Among these three muscles, abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus, they are mainly related with the pollex or thumb. They are called outcropping muscles. Why they are say like that? After some time on image I will show you. They are outcropping from the superficial and deep in between them. That's why they are called outcropping muscles. Now related with the superficial muscles some of the information, and related with the deep muscles some of the information we have to remember. Related with the superficial muscles, you have to remember the 4 muscles, they are arising from the common tendon. We can say lateral epicondyle. So from lateral epicondyle some common muscles origin will be there. So what are that? From lateral epicondyle coming muscles, number 1 will be the extensor carpi radialis brevis, extensor digitorum, then extensor digiti minimi and extensor carpi ulnaris. They are arising from the common tendon of lateral epicondyle. And all the muscles, all the 7 muscles are crossing the elbow. All 7 muscles cross the elbow. This information we have to remember related with the superficial. Now come for the deep. Deep muscles, they are not crossing. They are not cross the elbow. That means they are originating below the elbow, maybe from radius, maybe from ulna and interosseous membrane. And all are supplied by a nerve, that is the deep branch of radial nerve, supplied by posterior interosseous nerve. Next, after the muscle, we have to remember about, in this compartment there will be artery. What are the artery? Artery are two in number: anterior interosseous artery and posterior interosseous artery. Then there is nerve. And what are the nerve? Nerve in the posterior compartment, mainly radial nerve and its branches. So mainly we have to remember either radial nerve directly will give or posterior interosseous nerve. It is a deep branch of radial nerve. So this is very shortcut, some of the summarized information related with the extensor compartment of the forearm. Now one by one muscles I will show you. I will say about the origin, insertion, nerve supply and their action. So let's start. The first superficial muscle what I am going to say about is the brachioradialis. Brachioradialis, its origin from actually humerus, supracondylar ridge on the lateral side. So its origin from the upper two-thirds of the lateral supracondylar ridge of the humerus. Okay, and it will be coming down and it will be ultimately inserted into the radius just above the styloid process. This brachioradialis related some information we have to remember. I wrote in shortcut. First of all, its nerve supply. Its nerve supply is by directly from radial nerve. Number two, very highlighted one point. Actually, we are discussing about the extensor compartment of the forearm, but brachioradialis do flexion of elbow. It flexes the elbow joint. This is very highlighting one point we have to remember. Though brachioradialis is a muscles of the extensor compartment, but it do flexion of the elbow. And it also can do pronation and supination. From the mid prone position it can do pronation, and from mid prone position it can do supination also. So it will be assist for doing supination from mid prone position, and also can do pronation from mid prone position. So it is quite unique action of the brachioradialis. In other muscles we are not going to get such type of any action. So brachioradialis is little bit highlighted one muscles we have to remember even for MCQ also. Next muscle is extensor carpi radialis longus. Extensor carpi radialis longus, it is also coming from the lateral supracondylar ridge just after the brachioradialis is started to get origin. So it is also origin from the lateral supracondylar ridge of the lateral sides of the humerus, and it's started to come down, and it will be inserted into the base of the second metacarpal. This is the second metacarpal. So base of the second metacarpal it will be get inserted. So extensor carpi radialis longus, I am writing here in shortcut, radialis longus, it will be supplied by which nerve? It is also supplied by directly by the radial nerve. And what is the action? Action, actually it will do extension of the wrist. So first function is it is doing, I can write here action. Action will be the extension of wrist. Extension of wrist. That is the common function. And it also will be helps to do, as it is the radial side one muscle, so it can do radial deviation, or we can say abduction of the wrist. So it will do abduction of wrist. Now this abduction has to do by assisting with one more muscle, that is the flexor compartment muscle. Name of that is called flexor carpi radialis. Now next muscle is extensor carpi radialis brevis. A small muscles compared with the longus, that's why name is brevis. Same, it will be origin from a common tendon of the lateral epicondyle area. Now it become little bit more down one muscle, so it origin from the lateral epicondyle of the humerus, and it will be inserted into the base of the third metacarpal. It will be get inserted. This extensor carpi radialis brevis, it is supplied by the branch of radial nerve, that is the posterior interosseous nerve. So here 2 point we have to highlight and remember directly by the radial nerve. Right now we got two muscle get supply. One is the brachioradialis, another one is the extensor carpi radialis longus. Now after that, whatever the muscle we are getting, maximum of them are supplied by posterior interosseous nerve. One more muscle is also getting a branch from the radial nerve, not by the posterior interosseous nerve. Slowly we are going to discuss that. What is the function of extensor carpi radialis brevis? Same like the extensor carpi radialis longus, it will be also doing extension. So I am writing just shortcut, do same like extensor carpi radialis longus. So it will also do extension of the wrist and abduction of the wrist along with the help of flexor carpi radialis. After that, the muscle which we are getting, it is the digitoram. Just remember digit. That means it will be divided and go to the digit area. How many division will be there? 4 for the forefinger. So, extensor digitoram, it will be also getting origin from a common tendon, that is the lateral epicondyle, and insertions before it will be divided into 4 tendon, passes through this extensor retinaculum, crossing the wrist joint and heading towards the toward the forefinger area. So it is divided already into the 4 tendon. Okay. Now, these 4 tendon will be inserted into the middle and terminal flanges. This is the middle flange and this is the terminal. So, first it will be split it into 2 and ultimately it will be terminated into the distal flange. This extensor digitoram, will do what? It will do extension of the middle forefinger. It will do, first of all, what is its nerve supply? Its nerve supply also posterior interosseous nerve. Its nerve supply posterior interosseous nerve. And what is its action? It will do extension of forefinger. So it can do extension of the middle forefinger or digit, can also do extension of the wrist as in the common function. So wrist extension. Group function is extension of the wrist. So they will, other than other muscles like, it will also do extension of the wrist, but it also have a very specific function, that is the extension of the forefinger. Then extensor digiti minimi. Extensor digiti minimi. This extensor digiti minimi, again it is also coming from the common lateral epicondyle area origin. Name is, you see, digiti minimi. So it will be actually same like along with the extensor digitoram comes, and it will be inserted into the terminal structures of the little flange. So it will be inserted into the terminal flange area. So extensor digiti minimi, I am writing in shortcut. Its origin from the lateral epicondyle, same like the common extensor origin. Along with the extensor digitoram superficialis, it will also come out and goes to the little finger area, and same into the terminal phalanges of the little finger it will be get inserted. What will be its nerve supply? Same like posterior interosseous nerve. What is the function? As it is going specifically into the little finger, so of course it will do extension of the little finger. It can also do extension of wrist. It can help in doing the extension of the wrist, but its main prime function is to do extension of little finger. It also can do extension of wrist. After the extensor digitoram, digiti minimi, now we are going to see about the extensor carpi ulnaris. Extensor carpi ulnaris, common tendon from the lateral epicondyle again, and it will be going down and it will be inserted into the base of the fifth metacarpal, So same extensor carpi ulnaris, common tendinous origin, then it will be inserted into the base of the fifth metacarpal. Now this extensor carpi ulnaris also, we can write here extensor carpi ulnaris, it is also supplied by the posterior interosseous nerve. And what is its function? This extensor carpi ulnaris will do, along with the flexor carpi ulnaris, it will do adduction. It will do adduction of the wrist, or we can say ulnar deviation of the wrist. And it also can help in extension of the wrist. So as like, if you can remember, the extensor carpi radialis longus and extensor carpi radialis brevis, they are doing as like abduction of the wrist. So it will do adduction of wrist with the alone with the help of flexor carpi ulnaris, plus it has a common group function, that is the extension of wrist, adduction, or we can say ulnar deviation also. After the extensor carpi ulnaris, there is a very small muscles here, you can see, name of that is called anconius. This anconius, it is also origin from the common origin area lateral epicondyle and inserted into the posterior surface of the ulna. So this anconius, it is supplied by a direct branches coming from the radial nerve above the elbow. It's not getting branch supplied by the posterior interosseous nerve or not directly by the radial nerve. It is getting nerve supply by a branch of radial nerve. We are saying branch to anconius muscles. That is the nerve supply. And it is a weak extensor of the elbow. Sometimes we are asking what is the screw movement muscles. Actually, anconius is helping for a screw movement in our elbow joint area. So, what is the function? It is a weak extensor of elbow. Here you just highlight a point, it's crossing only elbow joint, so it will work also only into the elbow joint. It doesn't have any work on the wrist joint, and sometimes we are saying it is a screwing movement muscle. So related with the anconius, one highlighted point, it is supplied by the branch to anconius from the radial nerve. It is a weak extensor of the elbow as it is not coming toward the wrist, so it doesn't have any action on the wrist and it do screw type of movement. That's why we are saying it is called screw muscles also. Now we are going to discuss about the deep muscles of the extensor compartment of forearm. First muscle is supinator. You can see here supinator. Its origin from the lateral epicondyle ligaments related with the elbow, then annular ligament also, and supinator crest of the ulna. From this all area the supinator muscle is originating and insertion into the upper 1/3 of the posterior and lateral surface of the radius. So here actually radius is under this muscle, so we can't see it. So origin from ulna, origin from the lateral epicondyle area, this from everywhere it is originating and insertion into the radius, posterior lateral surface of the radius. So related with the supinator, we have to remember what is its nerve supply. Its nerve supply by the posterior interosseous nerve. And what is its action? By name we can understand it can do supination. But we have to remember who is the chief supinator. Biceps brachii is the chief supinator. Next, abductor pollicis longus. So here you can see on a screen there is abductor pollicis longus. As I said, abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus, they are outcropping muscle. You just see their direction. They are just coming outside by outcropping. So this type of muscles we are saying it is called outcropping muscle. Anyway, abductor pollicis longus. Let's write here abductor pollicis longus. This abductor pollicis longus, its origin from the lateral part of the posterior surface of ulna. You can see this is the ulna. Then it will be inserted into the first metacarpal. You just see it is inserting into the first metacarpal. This is first, then second, then third, then fourth, then fifth. So it is inserted into the lateral side of the base of the first metacarpal. What is its nerve supply? Its nerve supply will be by the posterior interosseous nerve. What is its function? By name we can understand abduction. So as it is pollex going area, thumb going area muscle. That's why what will be the action? Action will be abduction of thumb. Abduction of thumb. That is abductor pollicis longus. Next, extensor pollicis brevis. Let's write extensor pollicis brevis. Extensor pollicis brevis also origin from the posterior surface of the radius as well as from the adjoining interosseous membrane. So from here, this extensor pollicis brevis, radial sides and interosseous membrane, from everywhere it is originating and inserted into the base of the proximal phalanx of the thumb. Now from metacarpal, it will be going toward the proximal phalanx of the thumb. So dorsal surface of the base of the proximal phalanx of the thumb will be the insertion. What will be the nerve supply? Again nerve supply by the posterior interosseous nerve. What will be the action? Name is extensor, so it will do extension of thumb, extension of thumb at metacarpophalangeal joint. Okay, then come for extensor pollicis longus. As we know, extensor pollicis longus. Now, extensor pollicis longus arises from the posterior surface of the ulna and adjoining interosseous membrane. So, brevis came from the radius and longus came from ulna, and both of them are coming from the interosseous membrane also. Now, these extensor pollicis longus, it will be inserted into the distal phalanx of the thumb, where on the dorsal surface of the base of the distal phalanx. Now, let's write here extensor pollicis longus. So, what will be the nerve supply? It is also supplied by the posterior interosseous nerve. Now, what is the action? It also can do, of course, name is extensor, so it will do extension of thumb. So, both are doing extension of the thumb. In case of the extensor pollicis brevis, we have to remember it is doing extension in the metacarpophalangeal joint as well as carpometacarpal joint. But in case of extensor pollicis longus, it will do just extension of the whole thumb. It also help in extension of the wrist also. After that, last one is extensor indicis. So, here you can see extensor indicis. Indicis, you have to remember it should be related with the index finger. So, extensor indicis, I am writing in shortcut. It arises from the posterior surface of the ulna. So, it arises from the posterior surface of the ulna. Now, these muscles along with the other extensor tendon like extensor digitorum, it will be come to the index finger and it will be inserted into the distal phalanges of the index finger. What is the nerve supply? Its nerve supply again posterior interosseous nerve. What is the function? As it is going to the index finger, so action should be extension of index finger. Extension of index finger. It will also help in extension of the wrist. So, group function extension of wrist also it can do. Extension of wrist. This is a group function that also can be done by the extensor indicis. So, that is all about the superficial and deep muscles with their nerve supply and action in the extensor compartment. Now, we are going to discuss about the anatomical snuff box. Anatomical snuff box, it is a elongated triangular depression over the dorsal aspect of the hand area, and it has boundary. What is the boundary? Anterolaterally, this is the lateral side, thumb side, and this is the medial side. So, anterolaterally, there will be two tendon. One is abductor pollicis longus, another one is extensor pollicis brevis. And posteromedially, there will be the tendon of extensor pollicis longus. So, here will be the tendon of extensor pollicis longus. The floor is pierced by a bones, name of that is main specifically will be the scaphoid, as well as trapezium also will be coming here, scaphoid plus trapezium. These are in the base of this area. Roof is covered by or formed by the skin and superficial fascia. So, this is floor and there will be roof also. Roof is formed by the skin and superficial fascia. So, here this is the anterolateral boundary, this is the posterior medial boundary, then roof and floor. Now, what is the content of this anatomical snuff box? Why it is important for us? It contain here on screen you can see it contain radial artery. It contain radial artery. So, some other structures also actually crossing through this anatomical snuff box. Very important one is the cephalic vein. Sometime for IV infusion or blood taking time we can use this vein. Then terminal branch of the superficial radial nerve. Superficial branch of the radial nerve also passing through here. Now, what is the importance of this or clinical importance of this anatomical snuff box? As radial artery is here, so let's write clinical important. The clinical importance is as here is radial artery, so we can do pulsations, radial artery pulse we can check here. So, radial artery pulsation we can feel here. The tenderness of the anatomical snuff box indicate there is a possibility of scaphoid fracture because in this floor there is scaphoid. So, if there is a scaphoid fracture, scaphoid fracture. This area pressing means patient will feel pain. Then another, I already said, the cephalic vein. At this side we can use for intravenous fluid, IV fluid giving time or any injection giving time also we can use this cephalic vein. Then superficial branch of this radial nerve also have a clinical important. This nerve can be rolled over the tendon of extensor pollicis longus. Over this extensor pollicis longus muscles, this nerve is actually rolled. So that's all about the anatomical snuff box related clinical importance, its boundary and content. Thank you all for listening the extensor compartment of the forearm.